You folks ready? Yes, sir. Okay, call the meeting to order. We've got approval of the minutes from the March 6th meeting that we've got to address.
I'm moving short.
We have a motion to approve here.
Second.
Second from Fay. Any other conversation? Hearing none, call for a vote. All those in favor signify by saying aye.
Aye.
Opposed? None. Passes. Public comments?
I would just caution you that you've only got 4 members here, so in order to take official action, everything would have to be unanimous today.
I'm sorry.
You only have 4 members
Yes.
present, so it requires unanimous action to take any type of action.
Anything that isn't unanimous doesn't count.
Correct.
Yeah.
Okay, very good. Thank you.
Comment on that, we either need to do one of two things. One, get some more board members, or
Yeah.
two, not bring up any controversial issues.
I have,
So it's nice to meet once a month, and I think we need to do the health department's work. But it dawns on me that if we don't get any board members, it puts considerable constraint on those who are here to do it. Period.
I think we've lost 1 member since the last meeting. You understand that?
You
correct?
left after you did.
Yep, but, we had sent notifications to the 2 bodies that have the appointing authority, months ago, for the other 2 positions, and
Nothing?
I don't know nothing, but
Okay.
we don't have an appointed member.
All right.
So what's our plan?
I know it's being discussed, I was at a council meeting, and the council has correct appointment, and I know they're working on it, I know the commissioners are working with the city.
Do we have an ad hoc committee or anybody to recommend board members, either from this group like Teresa and I did the last time, or in another venue that we could actually try to establish some board members and try to have some continuity of what we're doing here?
Well, the reason that you had the ability to make a recommendation is because under the prior statute,
And that's no longer present.
it is for 5 of the 7 appointments, but the 2 appointments, so one of the 3 appointments we're missing right now would technically you'd be able to make a recommendation to the board of commissioners.
That's what we need to do.
But the statute changed January 1st. The new statute gives a, discretionary appointment to the county council, 1, and the city of Jeffersonville, as the largest populated city in Clark County, receives the ability to make a recommendation of 3 names to the commissioners, and then the commissioners then choose from those 3 names.
What about the other board member? I'm just saying that
That would fall under the old
And
style.
we can do that.
We could do a recommendation on, yes.
Diddy, I think it's, to our benefit as board members and the board of this group to meet and at least for that one member and be able to, make a recommendation. What do you think, Teresa? Make a recommendation. It's a motion, and then it's a discussable motion. What do you all think?
We obviously need adequate number of people.
Yeah.
Have you heard anything?
No, what I'm saying was that.
And what's gonna happen is, we're approaching the summer, and people will want to do things besides meet once a month.
So
And
we're
so
waiting
that's
on,
we're not gonna have a quorum to do business. Am I wrong about that?
so we're waiting on the city of Jeff and the county commissioners.
It's not gonna happen.
The county council has an appointment, and I know they've discussed it, I expect they'll have somebody.
I think the county commissioners are waiting on.
But that's the 2 entities.
For 2 of them.
Yeah, correct.
I don't mind making a phone call.
Yeah, well, the other thing too is, the board also has to be, it has to be populated with particular professions, those others, these other
Yeah, there's
requirements.
compositional requirements in terms of political party affiliation, and then there's also, statutory, professional,
Can you tell us,
Categories.
can you tell us specifically what that is?
you cannot have more than, 4 members from one major political party. I don't think the statute's worded exactly that way.
Are we balanced now?
I actually don't know. I know it used to be somewhere like 4 to 3. But I think it's, I don't know specifically off the top of my head.
And that's kind of the issue, because when you got 3 appointments available, we have to balance based on the political party. We have to kind of know some of who's coming on board, what their political affiliations are, because otherwise you can't have like 6 of this party and 1 of the other. It's, you know, so it's a little challenging when you're in a spot where you're looking for 3 people all at the same time.
Don't we need to know that?
We do, so it might be
I
best.
have asked both the representatives for the county council and the county commissioners and the city judge to communicate with one another about that particular issue, because I think that was potentially an issue if they both did an appointment from the same political party. That was not gonna be, you know, it's possible that we would exceed the maximum amount, but,
Well, we want the best, most qualified people regardless of party, so if
Oh,
we don't
absolutely.
communicate as we recommend those spots, then we can get in a position of, we're recommending somebody based on a party, not based on credentials.
so it would be licensed registered nurse, licensed registered pharmacist, licensed dentist, hospital administrator, a social worker, an attorney with expertise in health matters, a school superintendent, a licensed veterinarian, a registered professional engineer, and environmental scientist, but I think that's the whole.
We have lost 3 physicians. Those 3 positions are all medically licensed physicians in Indiana. Am I not incorrect in saying that? So.
So now you have school superintendent as well.
So if we're looking for someone, what would be, if we're allowed to look for one person, and what I'm simply asking about is concerning trying to get above a quorum of members, so we can do business in an orderly fashion.
Sure.
And on an orderly basis.
Then
Then,
we still have to wait for the commissioner to approve it, right?
You do, yeah.
So that's the thing, you can recommend somebody, but until they approve it.
and we've been that route before.
Yeah. So,
Okay.
so we can meet, I would say 4 of us could meet and,
You can't meet 4 of you without noticing a meeting.
oh, but a committee can meet.
No, not if it includes a
If
majority.
it completes all, okay, if a committee of 2 can meet,
Correct.
okay.
Okay,
So 2 of us can meet and try to find somebody.
I think we need to contact the 2 entities that do the appointing and try to stir that up a little bit. We'll get together and decide which phone numbers we're gonna call first.
Like I said, I do think the council is working on it. They,
Yeah.
it's brought it to the last council meeting.
It's not important for them to do, so they ignored it, so.
And I know the commissioners have
Yeah.
got their attorney, Scott Lewis, that has been working with the
Sure.
CJ, so.
Well, after
It's
the
all-
meeting, we can chat about strategy of getting to somebody. Apparently, you got somebody that you think would be a point of interest.
Well, it's not necessarily.
Okay.
We have some people that we worked on the last time that we thought looked really promising, but that did not come to fruition.
Typically, you come up with a list of 5 names, and that's submitted to the commissioners, and then
Okay.
they can just take that as a recommendation.
And the other thing is too, that if we're gonna see a need to meet on a monthly basis, as we discussed the last time, we need to probably change the format of contacting the board members a little differently. The reason being that it's probable that some of those people might be out of town when you're operating on that thin margin,
Yeah.
so that we can Zoom or have those people available and not just be hoping and praying until they show up.
Yeah.
You all think that's all?
We can definitely look into it. I know there's requirements as far as using Zoom for public meetings, this and that, but we can look into it.
Well, I've done that, when they Zoom into the house.
Yeah.
Where I stayed on the telephone
Yeah.
for an hour or something.
You need to adopt a resolution under the Public Records Act that allows you to participate via Zoom under specified conditions. I think I brought that up maybe the first meeting, because at some point, all meetings will have to be recorded and Zoomed, kind of, like I think we talked about, the city of Jeffersonville has like a system set up. I assume that the county is moving that direction, and we're trying to, figure out what the county-wide plan is versus do we need to make our own, plans for being able to have like an owl or something like that that would, but in order to participate in a public meeting as a sitting board member, there has to be an adopted resolution by the governing body that meets certain criteria.
Could you just give
I
it
can
to us
draft
and
that.
okay.
Is there any, when you're talking about needing to discuss this, is there anything that would prevent us all from just submitting names and compiling those without having to meet necessarily?
No, if you wanted to submit the names
Sure.
to Doug or Dr. Yeazel, they could submit those then to,
I think we gave 5 last time, I think 4 of those 5 are still, viable and interested in me. Now, the only thing I don't know is the political party side of things. I can't remember which side some of those land on, but I think otherwise they are all still, in the area, still very qualified, things like that. And then certainly anybody, we could compile a list of everybody's preferences and go that route.
For, would it, okay, well, I guess we 4 can meet.
No, you
Talk about
can't
one.
meet.
Or 2 of us can meet, and one in the closet or something.
Or you can always, or you could just email names, like,
Yeah.
I'll just send
Right,
along.
that's probably
Yeah.
the best thing, just email the names that we had before, that we
Absolutely.
think are still qualified and still interested.
And then any new ones that, that anybody thinks of, we can turn them in and, go from there.
Doctor representation,
Physician.
just plain and simple.
Well, we lost a veterinarian and 2
It
physicians.
would be nice to
And 3
have that
physicians.
back.
We lost 1 veterinarian and 3 physicians.
Yeah, Stone, Martin, and Thacker. Yeah.
Thacker.
Or 3 medical people,
Stone and Thacker.
Martin,
Oh,
Thacker, and Stone.
Yeah.
And then, what's his doing?
Yeah. Okay. Ready to move ahead? Handbook.
Public comments, actually.
Okay.
I think that's just me. Hi, Caitlin Blessett. I'm a Clark County resident. Last time I was here was through COVID, and this table was totally full, so I see your dilemma in losing board members. Just a question about your discussion just now. Is that a law that there has to be equal representation of major parties? It's not just a ordinance or policy that you all have?
it's not an equal representation, it can't exceed a certain maximum, and it is a statute.
Oh, okay. That's weird, because council and commissioners are dominated by one party, so
Well,
that'd be weird.
They're an elected body, so, that's a democratic process. This is an appointed process, and the idea is that, I assume that the intent is that the health board is not managed by, everyone from the same political party, whereas, I don't think we can intrude on the democratic process to elect county representatives who fit the,
Gotcha. Okay. Well, the reason I'm here is that I'm very concerned about the EMS status in Clark County. I don't know if you all are following what's going on in Floyd, and it was time for RFPs in Floyd anyway. New Chapel's contract was running up, so I know we're in a different position because we are under contract with New Chapel. But I've just been kind of digging as everything has come to light with Mr. Knoll and how it came to be that we have put New Chapel under contract. I was kind of surprised to see that it jumped from like a 1-year contract to a 3-year contract. And so I've, as you know, have requested tons of records. I've requested records from commissioners as far as looking at the contracts. I've requested response times from the EMS subcommittee, from the 911 board, request records from this board, looked through your minutes. I'm just confused about how New Chapel ever came to get a contract. Obviously, now that things have come to light, excuse me, the response times have never really met the safety plan, the 2014 Clark County Safety Plan, which says that the response times need to be within 8 minutes, 85% of the time or something. So even up to when you all approved this most recent contract in April, the response times were above 10 minutes. So I'm kind of shocked to see that you all maybe recommended or oversaw. What I'm told is that this is the oversight of EMS. That Dr. Yazel, you work with the EMS subcommittee, that you work with the 911 board, and then those recommendations come from that unofficial board, and then they go to the commissioners, and then the commissioners sign the contracts, okay, and then the council approves the funding. Was there a letter of recommendation for 2023? I see a letter of recommendation for 2020, 2021, 2022, but not 2023. So is that missing from my records, or was there not a letter written by you, Dr. Yazel, in recommendation of New Chapel?
I don't believe in 2023. Yeah.
Okay, so no letter. So there are letters for the previous years, unanimous recommendation. Unfortunately, I cannot substantiate that there was a unanimous recommendation. I've talked to 2 EMS board members. They say that RFPs were never discussed at all because there are members of New Chapel on the EMS subcommittee. So they say that RFPs were kind of off the table as far as discussion because that would have been a conflict of interest. They discussed response times, that kind of thing. 911 board, same thing. I've looked through all the minutes. So even though it is an unofficial subcommittee, there are minutes documented. I've obtained all of them. There are no discussions about New Chapel being recommended. So I don't know how that turns into a letter saying that we unanimously recommend New Chapel for a contract when those conversations are not documented, and I have people saying that those conversations never happened. So I'm not sure where the disconnect is there. And then there's no letter for 2023, so how did we get from no recommendation officially from anybody to a 3-year contract? Response times are not meeting the 2014 safety plan, which is all we have. No financial documentation has been turned in because, as we know now, they can't possibly turn in financial documentation because their finances are a disaster. That's why they couldn't meet the RFP in Floyd County. They can't produce financial documents because we're talking about a bunch of stolen money. So they have no audited financials. So I'm not sure how, and I understand the history, like, lesser of 2 evils. AMR was not performing well. New Chapel was performing better, but both were not really meeting the response times, is the history that I've obtained from the documentation. So I do understand that New Chapel looked better than AMR, but that doesn't warrant a 3-year contract. So, and also talking to the subcommittee people for EMS, they've been, I think, in favor of another solution outside of private contract, which is maybe a county-wide EMS or fire-based or whatever else might not be private. So those I don't know, are making it to the commissioners, the people who are overseeing contracts. I don't know if those voices are being heard or if we're just jumping to signing these contracts. So I don't like how everything has happened. And if this is the oversight of EMS and you all are missing members, and I don't even see discussion in your prior meeting minutes on EMS, I see that it's an item for today, so I'm looking forward to receiving an update. But are we in trouble with EMS? I mean, it seems like New Chapel could be shut down at any moment. I think Medicaid's looking into them. If Medicaid shuts down New Chapel reimbursement, they're in big trouble. They just lost a huge account in Floyd County. So does this county need to be worried about our EMS? And the other thing I want to say is I am completely shocked to see Mr. Stewart here as the attorney. You are Mr. Knoll's defense attorney. Is that correct? You're one of Mr. Knoll's defense attorneys.
That's correct.
So the oversight attorney is Mr. Knoll's defense attorney. You just turned in an expensive suit that you received from Mr. Knoll as a gift to ISP. So I'm not trying to hash everything out, but this oversight is totally inappropriate. Totally inappropriate. It's totally inappropriate for Mr. Stewart to sit on this board as EMS oversight, having just recently turned in an expensive suit gifted to him by Mr. Knoll. And I don't know if he was the attorney here during that time that he accepted that. I don't know what else has been accepted by him or any of you, but I'm not happy with the EMS process at all. So that's all I have to say about that.
We certainly appreciate your comments, and they're taken with a great deal of seriousness here. Comments, Mr. Stewart?
That's a lot. As for the recommendations, I don't represent the 911 board or any of the boards that, you know, made any of the recommendations. I know that this board met and made a recommendation based on those recommendations. As for a letter in 2023, I think that if I recall correctly, the way it worked was that they did an RFP process, which I would just say we don't control 3-year, 2-year, 1-year terms of a contract. So what the contract says is entirely up to the Board of Commissioners. As for a 2023 letter, they did an RFC around 2022, made those recommendations, and they went into, seemed like, set like 3-month like renewals, I guess, or temporary agreements that were kind of in place. But there was not ever a basis to say like, you need to re-bid, re-RFP this contract in 2023. Nobody ever requested that of anybody here. Again, we don't control public bidding. Whether a contract is signed or not is something that's up to the Board of Commissioners.
Yeah, judging from that, it was almost like your impression would be that I would do like a yearly recommendation, and we only do a recommendation for services, you know, when asked for it and when an RFP is up. So there wouldn't necessarily be a 2023 unless there was an RFP or something along those lines. So that's why you don't see one for this calendar year. As far as, you know, when you mentioned the, that some of the EMS subcommittee didn't feel heard or things, I interact with those gentlemen almost every single day. So I think any, accusation that they didn't, agree with what I said is pretty unfounded at this point. There are some definite desires to look at the municipal side of things, either fire-based or a third-party municipal service. Those also are things that don't happen with the snap of fingers. Those discussions are happening, and you're actually seeing that. You're seeing Tri-Township EMS start to flex up. They actually got a truck approved yesterday, and Clarksville's undergoing the process. We certainly would support, anyone else that decides to do that, provided it's in the best interest of the overall service of the county. One thing we do have to be concerned of is, what one municipality does. There are trickle-down effects to other municipalities, and we need to make sure that essentially no area gets left behind as well. So, we do, but we have supported Tri-Township, we've supported Clarksville, had conversations with other places as well, and we'll continue to do that moving forward. We've talked about there are basically 3 different scenarios that could happen. One's the one you mentioned, where we get notification that as of midnight tonight, they have to cease operations for legal reasons or Medicaid or things like that. The middle scenario is that they have enough operating issues that they can't continue to meet the requirements of the contract that they have with the county. And then the final one is they serve out the remainder of their contract, and we put up a new RFP similar to what Floyd's undergoing right now. And we have plans in place that we're continuing to, for each one of those scenarios, that we're continuing to tweak as new information comes out and things like that. The response time criticism's fair. I'll be honest with you, we've never met those even back in 2014 till now. We've always been over about, and that standard came from the state average response time is somewhere around 8.5 minutes. We've pretty much always been somewhere in the 10-minute range, 10 to 11 minutes. Really, this last month, we were at 10:48. We did have one that was longer the month before. That was the first time, I believe, that I've ever seen it up in the 11-minute response time range. We did request an action plan to back up a little bit, I also don't know that an overall, just blanket average response time is the best way to look at things in the county. So we did institute a process where somebody could just complain about an individual run and say, hey, it took an unacceptable length of time to come to see my, to come to pick up my grandma. Because I think even if our response times look great, but it took 30 minutes to get to a full arrest, even in a one-off, we need to know about that. And those started to escalate November and December of this past year, so we requested a response plan from New Chapel on that. They did work to put a unit up in Henryville, which is really one of our areas. If you look at the response times, there's one of the ones where you've got enough runs that it needs to be covered, and the response times are too long up there. And so they've tried to allocate some resources up that way. I think we've all talked about this. I know Floyd County's mentioned it as well. The overall workforce is a struggle. So when you talk about bringing in a municipal service or something like that, it's also very hard because I'm not sure we could hire for that very easily. So that's a barrier as far as not necessarily in doing it, but in length of time you can start up a service. And they're running into that as well. Now, sounds like they're very likely to not be serving Floyd County anymore, so they may have some resources in the short term for us. So that's another one that we'll have to continue to monitor its effects on our response times and, go from there.
Couple comments. One, and these are just questions that I kind of have, and I hope the other board members will say something because I don't want to be the inappropriate voice in the wilderness here. But one is there an appearance of, and Mr. Stewart has done a wonderful job for us in terms of advising us, giving us very good. Is there an appearance of a conflict of interest between our attorney and the person who is involved in a private litigation, ostensibly illegal activity of a overseer of the New Chapel service, i.e. Mr. Noel? I don't know if that's the case, but I wonder out loud, do we have, and I say to the other board members that I'd like to hear something from somebody.
Was it the December meeting that you told us that you could only advise on procedures, not necessarily opinions and decisions on who got what contract? You told us that day you could not, and you excused yourself when that discussion came up.
I did.
So looking at your advice and your contribution to the board, it seems to me it's only been on procedures and that sort of thing, nothing to do with the Mr. Knoll situation.
That's
Am
correct.
I wrong on that? That's because when you brought that up, you said, I have to excuse myself on this particular discussion.
Yes.
Yeah. Whether you feel like it's gonna get more involved and more deep and more advice on that particular situation,
I would
then
say,
that would be up to you.
well, actually, I would say it's not up to me. It's entirely up to the board. I would say that, yes, I have basically noticed you all and said that there are things that I will no longer be able to advise on.
Right.
And I have done the same thing, I think, with any day-to-day operations. But at this point, if you want to seek independent counsel, that would be entirely your decision. I think I have expressed some of my concerns, but it's a situation where I also did not want to step away from and leave a board that I had represented for a number of years. One of my, first jobs was representing this board. So, whatever this board wants to do.
If I remember right, Zach did not influence any of our decisions on accepting any intellect service. You were the one, you and Doug were the ones that gave us the information that we need to study and to learn and to make a decision about. So am I wrong on that? I don't remember Zach giving an opinion on anything. So that's just my opinion on what's going on. Zach's the one that brought it up. you know, I have to leave, I can't be part of this discussion. So that's just what I'm gonna say about that.
Do you think it would be prudent for us to put together 3 or 4 people, committee that investigates how we do this, what actions would be appropriate to improve the production, and bring it back to the full board when we have one? And
Well,
I think we-
I mean, and to address the question, or I guess the statement about there was no discussion at the previous meeting, I don't know if you have a copy of the minutes from,
Oh, I'm sorry, I only had the one that was online. You're right, I don't have the previous meeting, because they wouldn't have been online yet.
okay,
They haven't decided yet.
okay. Well, I mean, they're publicly available at this point, so if you want the meeting minutes, and I don't know if this is to your point, but there was a discussion about
Thank you.
the creation of a EMS subcommittee that would be a fully public board. There would be, there were bylaws that were approved, I can't remember exactly, I think they were approved, but the rules on the bylaws specifically exclude any type of participation as a member for any EMS service provider, third-party service provider. I think I don't remember, it's 7 members.
7-member board, it's EMA, health department, fire representative, police representative, hospital EMS based representative, and then 2 at-large members.
So
And none of
the,
them can be involved in active service provision.
so they can sit on the board, but they can't vote on things like RFPs, like is Matt Owen and Holcomb still on that EMS subcommittee?
No, well, anybody can come to the actual meeting, but as far as the appointed board, no, there's nobody who's an active provider that's gonna be allowed to be on that meeting. It's,
Okay.
for some of the reasons that you mentioned, I think I agree. And to be honest, I'm the medical director for Tri-Township and Clarksville Fire, so I will have to step down from those positions, to be on this board, as well, so the rules goes for
But
everybody.
I would just suggest that it's just an advisory board, like they don't have, again, the power to sign, not sign. They can review things, make recommendations. But it is a place, I think, where, I think to address any of the concerns, you know, for service, or to come up with ideas for, situations that might occur. That board essentially has been delegated kind of understanding the task to come up with those things. I am not gonna be present and representing any part of that situation, so.
Also, I was gonna say about the minutes of the last meeting, you also and it really wasn't spelled out in this paragraph, I guess, but you went over how we came up, you kind of went over the history of the EMS situation and how we came up with what we came up with and where it all started 3 years ago or so. How we had was it the AMS, was that the other service, and they weren't performing, and New Chapel was stepping up to cover their shortages, and it was kind of a mess, and the money that the other companies wanted was $3 million versus $1 million or something.
It's I guess almost eerily similar to what's going on in Floyd County in reverse. You know, Floyd County is gonna take a higher bid because their service provider wasn't meeting their expectations. It was unfortunately the same thing in reverse for us, 3 years ago. AMR had almost like 100 episodes in 3 months or something along those lines, where they had no truck available, and some other quality issues. And we, again, put the RFP out, sent certified letters to numerous private companies, and the only bids we got were New Chapel and AMR again. Floyd just did the same thing and the only bids they got was New Chapel and AmeriPro, which is who bought AMR, a few years ago. The one thing that's challenging in general is, these private services aren't bidding on our contracts locally. And that's, that leaves us with very limited options when there is a service issue.
That's what I remember about the meeting last time,
I think that
we
there
went
were,
through all that again, because
just
we went
looking
through it
at
3
the
years ago.
records, there were like 5 entities that received some form of,
There's like SEALs, Heartland, some of the other private services there showed at least a passing interest.
Yeah, so I mean, only 2 responded, from what I remember.
And then the process, we talk about, bringing it to the 911 board meeting and the EMS subcommittee and things like that. That was when I was asked for an opinion. I did not feel like a unilateral, just this is what I think, so that's why we took it to that. There was no, requirement that we do that. My job is to represent the county, and that's why we went to all those different entities. And that's the purpose of this board that we're talking about now, is to make sure that there's a voice, and voices that don't have any active interest, like active, I shouldn't say interest, but active response capabilities in the county right now, so.
Can I ask one more thing? I'm sorry. I don't know if we're still in public comment, but do you know if other counties with our similar population have difficulty getting RFP bids? Or is it possibly that Clark County and Floyd are just known for corruption at this point? Maybe ambulance companies don't want to come here.
The main issue is, well, number one, yes, this is it's a nationwide problem. I travel all around the state, it's a statewide problem. One thing that hurts us more locally is that Louisville pays better. And a lot of their services are municipal, where they're in the, in different benefit packages and things like that. So, like when I work over at University of Louisville and see some of the Louisville fire-based EMS services, I know a lot of their people because they're from here and trained here and things. So I think that leaves us, there's a workforce shortage anyway, and then it's doubled down from that scenario. I won't argue with you that maybe some of those factors you mentioned also are contributing to that also, but that's one that I can't quantify, but not an unreasonable.
Thank you.
Can I ask a quick question? You mentioned Tri-Township. I know Amir and Dave have been working really hard to get their ambulance services on board. In discussions with them, they mentioned that there was some kind of loophole. I don't know if it's a state statute or a local ordinance or something that restricts them, if they did go online, to make transport runs. Can you speak to that? And is there something we should be doing now to kind of clear that way in case we need to resort to a fire-based EMS service?
That's a great question. So when you mentioned the response time goals and things like that, those are all from the public safety plan from 2014 was the last time I think it was updated, but some of the language from that is even older in that. And one of the things that's been a barrier is there's a stipulation that you have to have some degree of 911 territory, and then I believe a minimum of 4 units to be able to run in the county. Without going down a rabbit hole, there's some very valid reasons that was in place from years ago from some of our system, but now it kind of serves as a barrier, to be honest, for that reason. Obviously for Tri-Township, there's not that's not financially viable to have 4 units to cover what they need to cover.
Sure.
And so one of the focuses of the EMS board that we're talking about putting together and meeting is to look at that safety plan, adjust some of that. The response times. I mean, I'll be honest, like we've set a target that we can't meet, and even when all this gets fixed, I still think it's gonna be a challenge. Clark County's a tough cover. We're 300 square miles, 120,000 people, but all 120,000 people are essentially up against the river. So getting out to some of the far reaches of the county, make an 8-minute countywide goal really, really challenging, to be honest with you. I'd love to see that. But,
So what board would make the recommendation to adjust that?
The EMS board would form the recommendations. We would bring it here.
Commissioners
And
have
then take it to
change
the
the
commissioners
ordinance.
after that, so.
It's a commissioner ordinance, it's not our ordinance.
Yeah.
We can't enact laws, so.
So we'd be recommendation based.
So they would amend the ordinance and then bring it to you guys to ratify? Is that what I understand?
No, we don't. I mean, frankly, they could change the ordinance, upon, I guess, proper notice, because I think there are some penalty provisions in the ordinance, so I think you have to give certain 2 weeks notice after the adoption of it before it becomes effective, but it's a commissioner ordinance.
That was my question. What governing body had the authority? So.
Absolutely. There's a few other things in there too that probably need to be looked at and things.
Do we need to address the question or the concept of our current recommendation or status for New Chapel? Since that was a valid question that was brought up. Is there anything, Eric, that we should be thinking about in that regards? And the second question is, with this fairly significant litigation of another person at New Chapel, what do we need to consider any alternative action as a board or as a group in managing that? Because I would really hate to see, we do the right thing, but I would not want to see the board dragged into that because we did not think about anything on that regards. I think that's been a legitimate question from the outset. And what's your all's feeling?
I think it's a great point, and you know, I'll be completely transparent. Like when I go up to Indianapolis for some of the EMS meetings and stuff like that, I mean, we are not looked upon favorably. You know, we are looked at an area that has corruption, things like that. It's not something I'm proud of. You know, and I get asked a lot, like, why haven't we just stood up and said, you're out? Well, unfortunately, in a scenario, you know, you have to have viable alternative options, you know, or people can get hurt. And that's the crux of this matter. You know, we don't have, you know, do we have a plan if, you know, again, we find out they have to stop operating at midnight tonight? Yeah. You know, I've talked to and had conversations to where I'm confident that we could get the coverage we need in short term. Is that a risk to our citizens to try to enact that, you know, right now? Yeah, you know, I don't know that that's gonna come. Well, there's so many moving parts to be able to do that it's not an ideal situation. You know, I think probably the best path forward is to talk about this with the EMS board meeting, you know, and things like that. There's a lot of sentiment out there for looking at municipal services, whether it be fire-based or just municipal in general, you know, or even a piecemeal where you have, you know, one municipality says, you know what, no, we don't wanna do this, we wanna go private, you know, and the other ones say, no, we'll take care of ourselves, and you have some viable mutual aid, which is something that we haven't had in the county in quite some time, you know. We have mutual aid, but it's not as robust as I'd like. So I think, you know, we need to first and foremost, you know, get a plan in place so that if we do decide a transition is the way to go, that we can do a safe, smooth transition for all our citizens. And that's where we're at on that.
What do you think, Faye?
I'm just trying to process it, so I'm enjoying listening to the discussion and then decide.
Let me ask a question I should know. What are our performance criteria in the contracts?
Mainly it's the safety plan, to be honest. I don't know, the safety plan, like response times and to do the hospital oversight. There's a laundry list of things. There's not a lot of you know, other, I guess, stipulations to meet. It's more, you know, you have to show, you know, you're insured, you have to work with audit review at the hospital, and comply with the safety plan. I don't know what else am I forgetting. It's really about it, to be honest with you. Again, the JOT forms, so JOT forms are the things we talk about where like anybody can say, hey, I saw a quality issue or a behavioral issue. You know, these guys were rude to me, something like that. You know, those are things we've instituted to make sure that we're looking at things, you know, more at the granular level than just getting a laundry list of, we did 1,000 runs last month and it took 10 minutes. You know, I don't know that that's, and then if it's 10 minutes and 12 seconds the next month, you know, is that the best way to monitor what's going on out there? I don't think it is. You know, we could see that response time increase coming about 6 weeks in advance because again, those JOT forms started showing up. So we already knew there was a problem. We actually asked for a response before we even saw the overall bump in response times that we did, because we monitor that way.
Didn't I hear at the last meeting that one of the issues was not being able to fill staff.
Correct. Correct.
That ought to be something that's a contract requirement.
Well, they are contracted to have a certain amount of units of coverage.
Yeah.
And so when they're not able to staff that, then yes, that is a contractual thing. We don't necessarily have it written in that you have to have,
Yeah.
X amount of employees, but yeah, our contract does, demand that they have a certain number of units up and running. Yeah,
Does it have anything about the pay of the EMTs?
it's not.
Like, so, we can't say, Chapel, you've gotta pay your EMTs the same as Lloyd.
Right.
We can't say that.
I mean,
It's only up
we-
to them.
I mean,
It's important to remember that this contract that we're discussing is not a health department contract.
Yeah.
We have no authority to enforce this contract.
Right, could we,
It's not ours.
could we make suggestions as board and health department? You're not paying your employees as much as Louisville, can we do something about that? Or,
I mean, we,
I don't know, seemed like there's a lot of money there that could have gone to the. Okay. All right, those was one.
when you look at salaries in the area, they are not out of line though, to be honest. They're out of line with Louisville, but they're not, they pay more than some of the surrounding counties, not all of them, but I agree with you. Then you hear some of the other things, you're like, well, that could have gone to salaries for sure.
Right,
Yeah.
And I got a couple other things real quick. I spoke with Mr. Owen yesterday, so that way we can give the board an update of where they're at. The response times in Henryville and Borden have been obviously the higher ones. And what they've done, they put a unit out there in the Monroe Township Fire Department, is my understanding, and it was staffed, and then they just lost an employee, so now they're kind of back to zero on that. But at least that was part of the corrective action plan, was to go ahead and add another ambulance up in that region of the county to hopefully reduce these response times we're having up in that area. That was one of the things they have tried to do.
What has been our response time up there, Bill?
What's that?
What has been our response time in that area?
It's been, lady, Henryville's been about 18 minutes.
About 20 in Borden.
Yeah, I know it was 20, cause
Yeah.
we talked about that the last time.
Yeah, those outlying areas are one they struggle with. The other thing Matt's getting the certificate of liability, which is a requirement of the ordinance. It requires that the commissioners and the Clark County Health Department are named in that certificate of liability, so he's getting that taken care of for me. I did ask for the audit. My understanding is the State Board of Accounts is doing a full audit of the entity, and I'll have access to that once that is done. The expectation is the next couple of weeks is what I'm being told. The other thing they're also doing they're starting their own training institute to try and get some EMS folks into the system and get all that done. So they're waiting on a letter from the hospital so they can get their paperwork involved, so that way they can start their own training institute and start giving these paramedics through their own training systems. So that's how they're trying to bolster the number of their staff, is what their plan is.
May I ask a question?
Yeah.
I have not seen the contracts.
Mm-hmm.
What term are they? Do they have to write an annual report on their own performance to submit? Do we have any of those type of things
Yeah.
that we then can meet with them about their performance?
Well, New Chapel's gonna have to provide an annual report to us. And the other thing that's gonna happen too, this, EMS subcommittee that's now has official bylaws and is sanctioned under the health board. We're gonna ask that anybody provides in county attend those meetings to give us updates about what's going on and that kind of thing. It's also important to know that we're gonna notice this next meeting, hopefully we're trying to get done today. So the first meeting should be coming up, was it 16th?
2 weeks from today is the goal, provided we can get
Yeah.
a quorum there.
So we're trying to get that group together, the group of professionals we talked about. And that's where we're gonna ask New Chapel or any other provider to provide us a status update about where they're at.
Well, I think the short of it is we're spending a lot of money in the county. Lots of different results. Some of them are justifiable because of where they are. I think we need to demand performance.
And again, we sent them, certified letters telling them,
Yeah.
we've asked for corrective action plans, and we did receive one.
Mm-hmm.
The other thing we've done in working with the central line, those job forms that Dr. Yazel speaks about, I get them, Dr. Yazel now gets them, and now Mr. Owen also gets those.
Mm-hmm.
So that way, he's immediately being notified of performance issues that's being transmitted, via this electronic document.
Mm-hmm.
So, there's some things that we're doing to try and really quantify where the issues are and hopefully they can address them, so.
Yeah.
There are two more things, and I can't remember if I mentioned the House Bill 1302 last month. There are two things that are probably important to know that I think are gonna be significant changes moving forward to the next couple of years. Number one is Indiana's undergoing a 911 interoperability initiative, where basically an EMS unit is gonna be dispatched on basis of closest, most appropriate. So like out in Borden, honestly, probably Borden would get, in that scenario, would get served by Lafayette Township over in Floyd County. New Wash will be running into Jefferson County sometimes. That's gonna be, because right now, if you could have anywhere in Indiana, you could have a wreck on a county line, and you may have a unit in say you're on the one side of the county and there may be a unit 20 minutes away, but there's one 2 minutes away in the adjacent county. They don't know about each other a lot of times. Or if they do, it's just based on volunteer fire having active knowledge and saying, no, we need to call these guys. It's not formalized.
Mm-hmm.
And so Indiana's undergoing a thing where the different 911 systems will talk to each other. So you're gonna see some changes in how response goes in general, which, I think will be beneficial. I had a situation where, a kid was brought to U of L that had a wreck on the Washington County line, waited 20 minutes with a femur fracture. And there was a unit just right down the road that nobody knew about because it was the next county over. And so we're trying to fix that. And that'll change a little bit. The other thing that I think is important is House Bill 1302 was just signed by the governor about 2 weeks ago. House Bill 1302, basically long story short, EMS is listed as an essential service in Indiana. It's one of 14 states where it is. But they didn't attach any actual teeth to that. So you say, yes, you have to provide EMS service, but there's nothing saying you have to do A, B, and C to provide EMS service. And that's why I think from a funding and support side of things, it's always lagged behind. The first step in this 1302 is to say, okay, every county in Indiana has to submit a plan of how they're providing EMS, subsidies, who they're contracted with, how many units, just all these details. So we can get a view of the state of what's everybody doing, what are these funding gaps, what's it look like. So then we're gonna compile that and take it to the next legislative session and say, hey, this is the gap here, and this is why EMS is struggling statewide. But also it's gonna be excellent from a transparency side of things. If you say, like we talked about, I think it took too long for you to come here to get my grandma, I wonder what we're doing as a county. It's gonna be right there for every county. And you can also say, hey, County A, why are you spending this much when County B is spending this much? There's gonna be that public level of transparency moving forward on the basis of those reports, which I think is a good thing. So like right now, if you tried to look that up, not just in our county, but most counties, you can't find that information, at least easily. You'd have to dig through a stack of records.
So I would say, in answer to your concerns, and I think they're valid, very valid. Right now, I think our main concern is to figure out how to handle a response if they would close. That is our main concern. How are we gonna take care of our people? How are we gonna handle it? How we got to this point is very important. I think what happened was a shock to everybody, and how we got to this point is very important. And it needs to be looked at, and we need to try to find out where things went wrong and where we were blindsided or just not seeing what was going on. That's very valid. We need to find that out. But right now, as you can see, we've got emergency concerns, if you wanna say that. What happens if they get shut down? What are we gonna do? How are we gonna take care of the county? And Dr. Gazel has worked on the plans to do that. He's got, what, A, B, and C plans lined up if something falls apart tonight. So that's kind of what we need to take a look at right now. But I think you're right, and we need to go back and see what happened. But at this point, it's how to take care of what might happen tonight. So
Okay,
that's
thank you.
That's my answer to some of your concerns.
I hope you all can start looking at the next step after that, though, whether it be county-based, municipal. I know you're working on, state level things. If we can just maybe start working on those baby steps
Right.
towards the
That's what
next
it's gonna take.
solution, so that we don't find ourselves in this
I think that's
mess.
what's gonna take. But if you started off with response times, and that's our main concern too. And you can see why some of it's not working. But we're working on it, and we are gonna go, I think we should go back, like you said, and see how we got to this point.
Okay.
I'll be honest, I think that's gonna be the main goal, is looking forward, because we have that emergency situation, unfortunately, but, that emergency plan looks real similar to what it did in December. There's not somebody out there that I'm gonna properly uncover that all of a sudden can come swooping in here and help in a bind. That emergency plan, if they would stop tonight, I've had further discussions and concreted things up, but as far as what it looks like, it's very similar. So honestly, there's not a ton of discussion. It's, just waiting to hear, as Tri-Township and Clarksville increase their capabilities, watching what happens in Floyd County and some things like that. That affects our emergency plan. But really, probably the number one goal of this, the new committee that we're talking about, is to say, okay, where are we going?
Okay.
I'm walking outside. I'm in a health department board meeting.
Any other comments?
I just want to expand on one more thing, whether Doug or Dr. Gazel, you want to respond to it. And I'm not putting you on a spot to make a decision on what you think the best option is. Is it a funding concern that if we were to go to a county-based EMS service, is it a funding concern for a fire-based EMS? How does the funding point in here? I mean, we all know the lack of funding is everywhere. What do you all need in order to move your decisions forward?
It's a great question. Yeah. So, you probably know as well as I do the benefits of municipal versus private. I mean, honestly, from a private side of things, that's something that you write a check, you say the headaches are yours. Mm-hmm. When there's quality issues like we found, we also have less ability to come in there and say, we want this and this and this. They're not, their finances aren't always readily available like that, In a municipal service, there's a lot more challenges. They are, essentially county employees or a fire department employee and things like that. Fire services not all fire services want to do EMS.
Sure.
And the last thing you want to do is push somebody who doesn't want to do it into doing it. There's some that are very interested in doing it, and we certainly support that. It used to be a lot of funding issue, to be honest with you. It was much more expensive to have your own municipal service. The trade-off was, you have the local control, you tend to have, local folks running it, less turnover, more stability, things like that. The trade-off used to be more financial. Now that some of these subsidy requests, especially when you're essentially, like AmeriPro in New Albany, they're bidding against New Chapel and that's it. Those subsidy asks are getting higher and higher because there's not, vigorous competition for these. Mm-hmm. So all of a sudden the math of those start to get very similar. And so I do think that's why there's sentiment that way, and probably rightfully so. It's just, what does that look like? Is that a few municipalities doing it? Is it county-wide? And who, do we just say each municipality, you come tell us how you want to cover yourself? Do we say as a county, this is what we want to do county-wide? I think those are the kind of philosophical discussions that we need to have there. I think it's very hard if a municipality says we want to do this. As a county, how do you say, no, I'm sorry, you can't, Mm-hmm. I think they have some autonomy there, but again, you also have to think about the fallout of, okay, what if, 7 municipalities say they're gonna do it and one can't do it for valid reasons, what do they do? And then all the private services say, nah, that's not enough volume to justify, a private contract. So there's things we need to think about with that. None of those are insurmountable, but those are all questions that, I think are exactly germane to this. if that makes sense.
Yeah, and I just think, as budget season is upon us, we need to speed forward, our thinking and figure out, if there's gonna be need of more funding, we need to start thinking about that now.
100%.
Doug goes to the council meetings, he knows what a struggle sometimes it is to get funding for the things that we need, so I just wanna put that out there.
Well, we say even, the current contract, say, is through into 2025. That sounds like a long way off, but when it's, again, if you told me, and I know EMS well, if you said, here's a blank check, you start a service, for Clark County, it would take a year to 18 months, honestly, to do it right. So 2025 sounds like a long way away, but you're exactly right. If that's something that we're gonna do, it's time to start putting some things together for that.
Thank you.
And to be clear, this EMS board that's been formulated through the health board, one of the main tasks is to take this ordinance from 14 and fix it. There's a lot of issues with it, there's some definitions and things in there that are not even legitimate anymore. There's just a lot of cleanup that has to happen, but there's also some issues when it comes to just how it's structured, with having to have 4 ambulances to actually operate in our county and this and that. So like Tri-County, we're gonna have to address this ordinance to allow them to go into emergency services technically. So, and that's our very first thing, is to get that addressed, get that to the commissioners for a recommendation to change that ordinance. And because it's punitive, the ordinance has a punitive component to it, there has to be some publication and time, this and that, so it's gonna be a bit of a process, but I think Dr. Yazel, and I wholeheartedly agree that if Tri-County wants to step up and take care of the community, we want to support them in that endeavor. And if we need to change an ordinance to make that happen, then that's the recommendation we're gonna try to put together.
Going back to that, and I get there's a lot of things that need to be changed in that ordinance, is it as much as in the interim, knowing that one loophole sits there, is it an emergency order that the commissioners could sign, almost like a COVID kind of ordinance that would eliminate that loophole in case Tri-Township needed to step in at some point?
I can't, I don't know that I can speak on behalf of the commissioners on something like that. I think if a service wants to be up and running, and has the capability to do so, it's gonna be extremely challenging to say no in that scenario, and that's the best I can, best I can go with that.
That's definitely our goal, is to address this issue of the 4 ambulances.
And that sounds.
I just hate to see those apparatuses sitting there.
Oh, yeah.
Money
Agreed.
spent, equipment on those apparatuses. We have an emergency situation that they could respond to as backup.
Yeah.
Right.
And I'll go back to last fall, and Matt Owen was involved in that because I made a personal phone call to him during it. I'm very involved in Sellersburg. We sponsored the football stadium and stuff like that. We have a JV game. We have a player down on the 50-yard line with the bone exposed. Ambulance service wasn't immediately accessible. Tri-Township responded, right? But they had to wait for an ambulance to get there to transport. And we were at like 30-something minutes to get this young athlete to university. And that's why I'm concerned with that. So that's why I'm asking the questions I'm asking.
That's a much more eloquently put way than that's why I say it'd be real hard to say no, because you're exactly right. The more services that are out there running, the better.
And I'm not saying it's just a replacement. I'm saying as a backup in the interim, that ambulance could have got that child who's a minor and transported him to the hospital for emergency services. Not trying to trample on somebody's toes or anything, but to provide emergency services.
Well, we talk about mutual aid, and Tri-Township has always been very, supportive of mutual aid in the county and things like that. And that's always been a weakness, aside from everything else, is, when, theoretically the spirit of mutual aid is if there's a huge pileup on 65 and you all of a sudden need 10 units, mutual aid is supposed to pull from other areas. And, a lot of our mutual aid contracts, we get it done, but it's not, it's not as formalized as it should be. And having, sort of different entities running gives us that redundancy to make sure that we can show up on that, so no, you're 100% right. The nature of that clause sounds nefarious now, but really it had a good point 20 years ago. It was to say, okay, we're investing in EMS, another service can't come in the background and just cherry pick all the paying runs and make Clark County, have to pay a higher subsidy. That made sense at the time, so if you're gonna run, you have to pitch in on 911.
Sure.
I think it's fair. Now, in this current environment, though, it's been a huge barrier to, adding services and things like that. That's why we wanna adjust that for that reason.
So some of the language that we're talking about putting in the ordinance is, right now the current provider would be the primary ambulance provider in the county because they're contractually obligated. But like say if Tri-County, is on the scene and the contracted entity cannot meet the requirement of 8 minutes, then we want to change the ordinance to allow this other service to then have the right to just go ahead and do that run at that time. So that way, the contract's still in place. If they're not meeting the contract, then this other service can step in there and do what's not happening. So that way, it kind of addresses, it allows for the fire departments that want to do this to do it, but it also allows the fire departments that do not want to be involved in EMS a service.
I think it's perfectly spoken. The night I was referencing, they had an ambulance in New Wash dealing with it. They had one in Charlestown, they had one at Clarksville, and one at Jeff, and they just didn't have a service that could get to the field.
Do we have data similar to this going back very far?
Yeah, I know I've got a sheet like that ever since it started.
Do we have reasonably quick access to put in their contract, who the contractors are or were, and when they took their position in the contract? So we kind of look at it, kind of figure out if there's something that's to be told, and try to analyze that. You got tough areas that are just difficult to serve. You've got some that are large in numbers from opportunity to serve. It just seems to me that there's something that we need to tackle from how we're administering. I'm not talking in a negative form on our part. I don't know that we've faced any of this before.
Well, in addition, it's a moving target, right? I mean, you talk about River Ridge and Charlestown's growth areas and things like that.
Mm-hmm.
The coverage dynamic in our county today versus 5 years from now
Yeah.
is going to be entirely different too. And so I do think we need to launch those trends over time and things like that.
Yeah.
Those reports come from 911.
Yeah, we're in a different economic time from the perspective of employment. I don't care which business you're in out here, whether it's in the ambulance business or whether you're making socks. You got an issue, you gotta hire folks. And if you can't get folks to come in, and then when you get folks that come in, they didn't realize they were gonna have to work, and you got an issue there. You got an issue with the wages. It just goes on and on. I think everybody has dealt with I can't hire people. Well, most of that's in wages. And when I do hire them, they don't work. That's another issue. So how do we resolve that?
I always say there's no field out there that has the level of, stress, knowledge expectation, public expectation that's out of balance with, reimbursement like EMS.
Yeah.
I mean, they can go to Chick-fil-A and get a $2 an hour raise, and that's not knocking Chick-fil-A or anything, but, your options are, I can, go out there and see a dead body on 65, and I'm barely, not making much more than minimum wage.
Yeah.
And that's the challenge. That is where I think some of the municipal services have an advantage because they do get vested in some of the retirement plans and things like that. But right now in Indiana, at least the average career span for a paramedic is 5 years. So, I mean, we're just bringing them in and spitting them right back out because it's such a tough environment.
I had an interesting conversation with my granddaughter that's a pharmacist, and she was complaining about hiring employees. And I thought, a pharmacy's complaining about hiring employees that they either couldn't get them in the door to interview and apply, or when they did get them in, there were issues. So,
I think that's why you're seeing some movement towards some of the fire-based services.
Yeah.
They're one of the few sectors that still gets, 30 applications for 5 spots and things
Yeah.
like that. And so what a lot of other services are doing, they're saying, all right, you come on and run EMS for me a couple of years and work hard and we'll bring you on in. That's great for workforce, but it doesn't necessarily mean you're getting people in with a passion for EMS either. It's, I'll do what I need to do to get on with the fire department sort of thing. So there's, if there was a perfect model for EMS, I think every county out there in Indiana would be doing it. You just have to find out what is the best model for your area.
well, they're all different.
They are.
And that's simplicity of it. But people are all pretty consistent. Even though the areas are different, we've got to figure out something along there, figure out something to do on contracts. It's a task, it really is.
And just to speak to more.
You two over there have anything to say?
Just to kind of clarify these EMS response times, so that's not the only indicator we're looking at. The job forms are really, really important. So, there's quality of care issues we gotta look at. Another thing that can happen too, I'll get a phone call from, Chief Furnish up in Henderville, and, he'll say there was a 35-minute response time, which is awful. But what we try to do is go back to Central Alarm and find out, okay, how many runs are actually happening in that same period of time? And sometimes we're finding out there's like 6 call-outs in 20 minutes. So that's 6 ambulances already on a run, and you're up in Henryville, there's a contract for only so many ambulances in the first place. So sometimes we have these really long response times, and it's kind of like you were talking about earlier. It's not because there's not an ambulance available so much as the fact that every ambulance that is contracted is on a run. So
The other thing those job forms allow is, and that's why I'd say, I don't know the response times of end all be all, is just because you get there fast doesn't mean it's quality. And the job forms allow some sort of reporting on, hey, they were rude or didn't, seem to take good care of me, things like that. So that allows us to some oversight in that way too. And, we do see escalations in that. With the workforce side of things, I think people are tired. They're doing longer shifts than, I think that probably is ideal. I can virtually guarantee that. And when that happens, people are fatigued, they're not as friendly, they, aren't as good of a provider, and that's the reality of it, so.
or do they send the appropriate ambulance? Do they send a BLS unit when it should have been an ALS unit? These are the things that we're trying to monitor and watch. But it's more than just response times. I know the safety nurse talks about that, but there's just this quality care issues we got to look at, and actually know what actually happened in that time frame that long response time took place. So.
Nothing over here?
No, I think that's good. I think it's
That's
just an issue
No,
we've
that's
been
right, I was
dealing with
listening to what you're
forever.
saying, it
Okay.
certainly points to the negative.
Anything else you'd
of all
like to-
situation.
Input?
No, just I think the commissioners should be kept informed because they're the ones who pointed me this way as the oversight, because they haven't heard any problems in Clark County with EMS. And I find that impossible for the commissioners to not know that there's any issues with EMS. So maybe some sort of bridge there, communication.
Okay. Let's look into it and see if we can move forward.
Yeah, we are having meetings more often, which is.
That's great.
It's a good thing.
Mm-hmm.
We hear about it more.
Mm-hmm.
What was that, Trish?
I said we're having meetings more often, so we're able to keep up a little better. That was
Yeah.
probably not good to wait so long.
We communicate.
I'm sorry?
We do communicate
Yeah.
what's going on.
We get emails
yeah.
and stuff, but to have formal meetings, we really do it 4 times a year.
Gotcha.
Well, where are we?
Kind of discussed health board appointments earlier on, so I guess we're down to employee handbook revisions.
Yeah, we've got to get the appointments.
Yep. The employee handbook revisions, so the county is redoing theirs, and as you know, the health department has their own handbook because we function different than the auditor's office, so to speak.
Okay.
They're more an 8 to 5, and we're all the time. One thing that I kind of want to try and address today, if I can, the county is now getting a electronic time tracking system, time clock, basically. And our current handbook goes by the Rule 7, which is the rounding. You know, you show up at 8:35, it's 8:30, that kind of thing. I want to try and get it to where it's actual minute clock in. So I'm asking if we could eliminate the rounding policy that's in our current handbook effective June 1 and get to just, it's, if you're at 8:32, you're in at 8:32. You lost 2 minutes of pay, that kind of thing. So we're trying to get as much of these county policies the same as we can, with, except for the nuances of the different departments, you know, like us having work weekends and nights and everything else, So basically what we're asking for is to do away with the rounding component effective June 1, so we get into this new time tracking system that will effectively, when you clock in at 8:30, it's 8:30. You clock in at 8:32, it's 8:32. It doesn't roll back or forward or whatever. So basically, I'm just asking for a motion to change it from rounding to just it's by the minute.
I agree, it's gonna cost us a lot of money over a long period of time for a lot of people. I'm so moved. That we do it on a
I think
minute
that with all
basis.
the electronics today, we can actually calculate. It used to be when you did payroll by hand, 7 minutes was not the big deal. But I think that now with all the electronic
Right.
ways of doing bookkeeping, I think if they give her 8:30, then
Right.
it start getting paid at 8:30.
And it's gonna make it a lot easier as far as when payrolls do, just honestly,
Right, you don't have to worry about
get some of the hand.
hand do it, I know, so, that's my input.
I call the question.
That it?
Just need a,
Any,
There's a motion on the
any
floor.
other business?
I think that you made somebody made a motion,
You
right?
want a second? I'll second the motion. Did you make the motion? I'll second.
Okay.
It's just to phase out the.
I'm gonna call you.
Okay. Call for adjournment?
We need a
Call
vote.
vote.
You would need
Call
to.
for
I can't hear.
You
gotta
need to
vote
Call
on
for a
that.
vote.
Yeah, you need to vote on.
Call for a vote on what?
On the rounding,
On the rounding.
that we go to a minute,
We have a
real
motion.
time.
yes.
Yeah, we have a motion.
Have a motion,
Have a
second?
yeah.
Okay, call for the vote. All those in favor signify by saying aye.
Aye.
Opposed likewise. Passes.
Great.
Call for adjournment.
You got compensation on.
Yeah.
You probably won't say.
So you got.
Conversation?
I just put this on there this is simply for you folks to discuss. You know what your current compensation is for the year. You've increased your meetings. I didn't know if you want to address the compensation, leave the compensation the way it is.
Well-
If you want to increase it, I'd have to address it in the budget.
You're gonna have to go back to the entities that pay for it
Right.
and tell them what we've got and get their input, which they're not gonna wanna pay.
The
So-
county
so
council
we-
would have to alter the pay schedule because the statute requires.
Well, we got the same pay for years, and I think you increased it just a couple years ago.
Laura did,
I move it.
yeah. Laura did it.
Laura did it,
Yeah.
okay. That you said lowered it.
I think it should.
No, it-
Yeah, no, I was just saying you didn't lower it. No, I think that we've had the same pay. I mean, we had an increase a couple of
Okay.
years ago. So, I mean, that's okay with me. I don't know how the rest of you feel.
I have a little different viewpoint, and that is, I agree, if we're only meeting quarterly, I fully agree with
But.
you, but at the same time, if we're gonna meet every month, i.e. 4 times more,
Yeah.
then we should be, it should be a consideration, because we're not doing that, or we make a point that we back down on our frequency of meetings, one of the two.
I think we need.
And that is, we're operating real tight right now with just a minimum quorum, as Mr. Stewart pointed out quite succinctly early. And so it puts a burden on we 4 to be here, and we must be here,
I
so.
think we need to have meetings, I agree there.
Let
Is
me
this something we can
offer,
talk about this month and let you know at the next meeting?
That's fine. And this is something that can be addressed in the
Right.
Yeah, I
budget as
agree.
well.
let me offer, when I was commissioner and we approached people, first question they would ask, well, what's
What
it
does it
pay?
pay?
You know, am I gonna be compensated for my time? And you had some that if you said there is no compensation, they said, no, I'm not interested. So you've got that to deal with.
It's
And
so minimal.
and chances are, your more qualified people
Yeah.
are gonna be worth more compensation. And I'm not saying we got a scale, but to ask them to take away from their profession to go to a meeting, once a year would be fine. But when you're asking them to go to multiple meetings a month, you got an issue, so you gotta think about it.
Well, that is something to think about.
We can address it at the next meeting.
Okay, let's, think about it, see what you wanna do, because I guess kinda wanna know what we're gonna ask for if we do ask for a raise.
Right. I'll just kind of leave it up to the
Okay.
members of the board.
All right, well, that's,
It can be addressed in the next budget. That might be, the easiest way to deal with it, but.
Well, it does take time, effort, and change in schedule to be here for the board. And the board has typically worked pretty significantly for relatively low compensation, and we're glad to do this for the county. But at the same time, if we're gonna up the schedule and have a high frequency, this is a board, not the Salvation Army. So, and I'm fully opposed to the Salvation Army, by the way. It ought to have some consideration.
that it?
Where are we?
I move we adjourn.
Okay. Move to adjourn.
Second.
Second. All those in favor signify by saying aye.
Aye.
Opposed likewise. Adjourn. Thank you for your all's input.
Thank you.